The Ebola patient in Dallas, Texas is in stable condition, but officials say since his arrival to the States, he has come in direct contact with over a dozen people, including 5 children. The Center for Disease Control and Prevention is attempting to locate and monitor everyone who was in direct contact with the subject. The verified children have reportedly not shown symptoms, but are being kept out of school and watched closely at home. After the CDC announced the patient's diagnosis, some experts dispelled concerns of an outbreak.
Disease is tough to transmit. The authorities are tracing everybody that this guy came in contact with. So I don't think there's a reason to panic at all. That we shouldn't be doing.
Researchers at ASU helped develop the treatment used in the earlier cases. And as reporter Samantha Davis reports, they continue to study the disease.
I spoke with an epidemiologist today who studies the spread of Ebola. He wants to calm fears of an epidemic in the United States. A man coming from Liberia stepped off a plane in Dallas. Then, just 4 days later, developed symptoms of a deadly disease.
Ebola doesn't spread before someone gets sick, and he didn't get sick till 4 days after he got off the airplane. So we do not believe there's any risk to anyone who was on the flight.
Gerardo Chalpuente, a mathematical epidemiologist and associate professor at ASU, says that previous Ebola outbreaks in 1995 in Congo and in 2000 in Uganda have similar rates of spreading as the current epidemic in West Africa.
This virus is not significantly different to the virus that has spread before, and so that's good news in part.
Professor Chalpuente says that the risk of an Ebola outbreak in the U.S. is low.
We are very close to 100% sure that we will not observe an outbreak in our country.
Epidemiology isn't the only study that ASU has undertaken regarding Ebola. Professor Charlie Arntzen helped develop a treatment for Ebola that was used to help the 2 aid workers recovering from the disease in Atlanta in early August. The treatment used antibodies in modified tobacco plants to help save the lives of the workers. The risk to Arizona is also low, and continuing to research the disease and providing care to those affected in other countries may help keep it that way. From Tempe, Samantha Davis, Cronkite News.
And now here to explain more about this issue are reporters Alicia Canales and Justin McDuffie. Alicia, you met with state health officials today. How are they responding?
Right, so state officials are prepared in case there is an Ebola case in Arizona. The protocols and procedures are actually quite similar to what they already do for other contagious diseases. So local and state health departments are working together to identify, monitor, and isolate patients who may have been exposed to Ebola either by going to Africa or being with someone who has the Ebola symptoms.
Justin, in Washington, you're tracking the response from some international aid agencies. Which ones are taking action?
Well, Carrie, some of the more well-known organizations like the Red Cross and Doctors Without Borders are among the 30 organizations stepping up their efforts in West Africa. Other organizations that I talked to, like the Mormon Church and the Peace Corps, have decided to reassign their personnel as a precaution of health and safety. A spokesperson I talked to with at the Samaritan's Purse told me they'd like to send more people, but it's difficult because it's a place people have to be called to serve. Carrie?
Alicia, Justin, thanks for joining us. We'll stay in touch as the story develops, but you can always read more about our Ebola coverage at cronkitenewsonline.com.